Hey guys, my name is Mariam. Welcome to Hearts for Motion. Today I'm going to be talking to you a little bit about hypertension and what you can do to help lower your blood pressure.
So let's start off by quickly going over what blood pressure is and why it can be a risk factor for heart disease. The basic equation of average blood pressure is the total peripheral resistance of your blood flow, which is the force required to maintain blood flow through the body, multiplied by the cardiac output, which is the amount of blood being pumped through the system at one time. But why exactly is an increase in this pressure problematic for the heart? For starters, the heart has to work much harder and there is more force being ejected with each beat. This can cause an abnormal growth of the chambers of the heart, specifically the left ventricle, which is in charge of pumping the blood to the rest of the body. We also see less elasticity in the arteries. They become less versatile, which really impacts the optimal flow of blood and can also lead to a buildup of plaque along the artery walls. This causes a narrowing of the vessels and results in less room for blood to flow. Ultimately, this can increase your chance of blood clots, causing a complete blockage of the artery, which eventually will lead to a heart attack.
So now that we know more about what blood pressure is, I want to talk a little bit about what you can do to lower it. So there's a few tips and tricks that you can use in your daily lifestyle to help improve your blood pressure scores. And the number one thing at the top of the list, exercise. Exercise is really important for your blood pressure because it leads to a mechanism called vasodilation. And what this is your body's arteries actually opening up. Now, typically with what we said earlier, blood pressure and other lifestyle factors can lead to narrowing of the arteries and a constriction of the arteries and a stiffening of the arteries. So what exercise is doing is it's opening up that pathway so that blood can flow freely. And over time, as you're more consistent with your exercise program and with your other lifestyle factors, this can actually become a more permanent property in your blood vessels. So on top of exercise, there are a few things that you can change in your diet that are also going to help improve your blood pressure. The number one thing is sodium. So the more sodium that you intake, the more amount of water is actually reabsorbed back into your bloodstream. And this leads to an increase in that total blood flow that's going through your system, leading to that increased resistance that we were talking about earlier. And that increased resistance is going to increase the pressure as well as increase damage to the artery walls. Your fiber is also really important because it actually slows down digestion. This in turn helps to reduce the spikes of sodium in your system. It also helps with proper absorption of water. So according to the DASH diet, which is recommended for hypertensive patients, the recommended numbers are 2,300 milligrams for sodium. Ideally, it would be better to keep it around 1,500, but the maximum is 2,300 on a daily basis. And for fiber, it's actually 30 grams. And most people don't actually get that much fiber in their diet, so it's really important to be intentional about it. Thanks so much for tuning in. For more information about heart disease and how to lower your risk factors, check out my Instagram page @HeartsForMotion, which I'll link in the bottom description. Until next time.